Ladies and gentlemen, there are 6 million coronavirus cases in the US. This was announced today, and this happened in a 7-month period. 6 million COVID 19 cases. We're going to listen to this video that came out today on CNN. So, this is CNN Health. US has just topped 6 million coronavirus cases in about 7 months. What happens next is up to you. And this is August 31st, 2020.
Turmoil at the CDC, controversy at the FDA, and reporters digging to find out why keep getting directed to the White House. That turmoil comes as the president and top allies paint a coronavirus picture that doesn't quite match the coronavirus reality. Let's look at the latest trends, and let's start with our 50-state trend map. 18 states right now, that's the red and the orange. You see a lot of them out here in Middle America, reporting more cases today than a week ago. 18 states trending in the wrong direction. You see 23 states, that's the beige from coast to coast, holding steady. Only 9 states at the moment reporting fewer cases now than a week ago. Importantly, they do include Florida, Texas, Arizona, and California. Those were the states that were the big drivers of the summer surge. They're in better shape right now as compared to earlier in the summer. If you look at the case curve, this is instructive. This is where we are right now, averaging about 42,000 cases a day. This is the peak of the summer surge, 67,000 cases a day. Just before that peak, one day before that peak, is when the president finally showed up in the White House briefing room to hold up a mask and say masks are good. That was after this giant summer surge. You go back to June, we were down to about 20,000 cases a day. Then that. We have Texas reopening here. Just to remind people, the reopening started with Texas, Florida soon after. Other states started to reopen. We've gone through this for 7 months. You count a couple weeks, up we go. So here's where we are right now. And this is, if you look at it from this perspective, still 42,000 cases a day. So you need to test to get eyes on the virus. Well, we're averaging about 700,000 tests nationally. 16 states trending up, meaning more tests now than a week ago. 15 states trending down, fewer tests now than a week ago. And if you look at it this way, this is what gets interesting. The positivity rate, still 12% in Florida, 15% in Mississippi, 18% in Iowa, 14% in Missouri, 15% in North Dakota. A lot of these states still have a high positivity rate. You want that rate down, 5% or lower as you watch this play out. Just want to bring up a couple quick other points we want to look at here. Where are we watching? Cases rising, right? Down in Florida a bit, down in Texas a bit, down in California, but look at Illinois, look at Kansas, look at Kentucky. Again, in Middle America now is where we're seeing the cases come back up. And because of that, because of the rise in cases in the middle of the country, the IHME now increasing its projected death toll. It projects 317,000 Americans will die by December 1st.
All right, y'all. So this is all all they can do is project, y'all. They don't have no answers for this. And that's the problem. Medical doctors and scientists are still learning about COVID. They don't have no real significant answers for us. So, as I said, the cases have topped 6 million in about 7 months. So just over 7 months, no one in the U.S. had a confirmed case of COVID-19. On Monday, the U.S. topped 6 million cases of coronavirus, which has killed over 183,000 people and left many young adults with long-term problems. But there's a bit of good news. As a nation, we are clearly doing better on the last day of August than we were on the first day of August. Daily cases have come down. Deaths are starting to decline. Hospitalizations are down. This is good news. It is largely because of smart policies in Texas, Arizona, and Florida around masking and closing bars. You know what? Don't get on your high horse. We are entering the flu season and fall and winter, and a lot of people have been exposed out here. These folks do this. They always try to paint a rosy picture when there is nothing rosy about this whole thing. Remember, kids have returned back to school. Many of these schools got to close down. They got to quarantine staff and students and teachers, and Now you got another situation in the country where that motorcycle rally, all of those folks went home, and you're starting to see states crop up with cases stemming directly from that. So it is way too early for them to be trying to take a victory lap. Okay, but there are still parts of the country where things are both bad and even getting worse. In the Dakotas, in Kansas and other states, we are seeing a lot of cases. And as a nation, we are still seeing a lot of cases of coronavirus. So progress, but we have a long way to go. Okay, many Americans are fed up with this pandemic, and some have let their guard down, especially when spending time with friends and family. But that's the opposite of what needs to happen. The White House Coronavirus Task Force coordinator, Dr. Deborah Bricks. We know we can't always be perfect. We know that we'll put this message out about private gatherings and something will happen and you'll realize you have been in a situation, you've been around people, you didn't have your mask on, Bricks said. That is the time to make sure you are protecting others in your household and around you by wearing a mask when you're around them, even if they're family. Bricks urge Americans to take personal responsibility, especially if they want to help the economy open up. And no, they don't. Right now, we gain freedom through wearing our mask and socially distancing. People ain't listening to this, Deborah Bricks. I mean, you're saying it all in vain. Two vaccines are now in phase 3 trials in the US, and a vaccine probably won't be publicly available until 2021. Health officials said Trump, he's running around talking about it'll be out before the election. I'm like, whatever. I mean, everything is surrounded by politics right now. But the Food and Drug Administration could consider authorization of a COVID-19 vaccine before phase 3 trials are over. FDA Commissioner Stephen Hahn told the Financial Times CNN has reached out to the FDA for comment. I tell you what, y'all can give them vaccines out all you want. I ain't taking no vaccine. I don't trust nothing that you put out. Still, health officials face a steep challenge with public trust and getting enough people to get a vaccine to really drive down this pandemic. A CNN poll this month indicated 40% of Americans won't get a COVID-19 vaccine, even if it's free and easy to access. Part of the problem is public skepticism of the FDA after the agency premature authorization. Remember when they came out with that malaria medication that Trump has been pushing? Yeah. So a lot of people are not feeling the FDA anymore and Trump. Okay. So, what it's like for scientists to drive this decision, for it to be very transparent, and for political leaders to not get involved in deciding when a medicine or vaccine is safe or not. But they will. They will. To increase public trust, several predominant physicians and experts have been called for the creation of an independent commission separate from the FDA to review the data from the COVID-19 vaccine trials. I'm hearing this from my peers, from doctors and nurses. They are not anti vaxxers, they're pro vaccine. They vaccinate their own children, but they are skeptical about this vaccine. Now, what does that tell you? Doctors and nurses that are working with COVID patients are even skeptical about the vaccine. Oh man, that says a lot right there. Okay, so Dr. Paul Mango, deputy chief and staff for policy at the U.S. Department of Human Services, says any approval of a COVID-19 vaccine would be the same as any vaccine. There is a thing called a Data Safety Monitoring Board, an independent body that is assigned to each clinical trial, Mango said. We have no insight into the data until the DSMB says we can look at it. We can come back and say, this is not a good vaccine. They could come back before and even suggest that 30,000 folks enroll and say, we have enough. This looks great. Wow. All I got to say, that says a lot. When your people, your doctors and nurses out here are even backing away from the thought of a vaccine coming out this quickly, it usually takes years to get a vaccine out. Rushing this through just so you can get an economy go, is at the end of the day, it's all about money. They don't care about us. They don't care if they give these vaccines out and it kills a certain portion of the population. They don't care. This government literally do not care. They want to rush this thing through, get everybody back out here working and getting their economy running again. And it just don't look good, no matter how you look at this whole thing. It don't look good for a vaccine to be rushed out here. And look, I did a video on more symptoms they found, hair loss, skin rash, and all associated with COVID-19. And that was not even 2 weeks ago. So, I just don't see how they're going to do this thing. I really don't. But y'all, please tell me what you think. The way I see it, I can tell you, I am not getting that vaccine. I'm not getting it. I'm not getting it. And now they're trying to force some of the students to get a flu vaccine. They're trying to mandate it. I was looking at a story that came out of Massachusetts, and they're protesting heavily against that. But yeah, they are now trying to demand that students get the flu vaccine. Whether they want to or not, they have to get it to stay in school. So we'll see how that goes. I don't think that's going to go over too well either. But y'all, please tell me what you think. 6 million cases. 6 million. Do you know how easy it would be to hit 10 million by the end of this year or even the beginning of next year? Would be easy. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.